Gastritis and peptic ulcer disease. 90% of these cases are duodenal ulcer basically. You may not see florid ulcer, but you have features of the your ulcer symptoms. Your and 10% naturally peptic gastric. So and then peptic ulcer disease incidence in children is peculiarly very high, not known to the many of the global population. 3.5 to 6.6% of the children, mostly above 12 years age group, do have peptic ulcer disease or gastritis. The secondary ulcers are not that uncommon also. Stress ulcer, steroid, NSAID, your IBD, chemotherapy, good amount of the diseases and the drugs. When they involve the stomach and the jejunum, you have the pain in the gastric region, you have vomiting, you may have increased satiety, and you may have the hematomesis and melanosis and that. Satiety, weight loss, they are affected in the cases where you do have the stomach involvement, and the meal exacerbation is possible. Child can have bleeding, significant bleeding, can have anemia in long term, not that common. By far the commonest presentation is epigastric pain and vomiting at times. It appears to be the GERD, gastrointestinal reflux disease. Diagnosis is by endoscopy, esophagogastroduodenojejunectomy. So diagnosis, confirmation, and treatment is like adult disease. The proton pump inhibitor or H2 blocker, at times combination, for 1 month, and then antacid 5 to 15 ml for 4 times daily for 14 days is good. HP, Helicobacter pylori cases, in 80% of the childhood cases, gastritis, they do have the Helicobacter pylori association. So diagnosis of this organism is by your stool antigen, IgG, pylori, urea test or the urea breath test, and microscopy of the histology of the your stomach and jejunum, and culture. But usually, you do not need to go to that extent. Why don't you give an refractory cases? Give one course of the anti-H. pylori regime, like amoxicillin plus clarithromycin plus PPI, or amoxicillin plus metro in case of the instead of the clarithromycin or and PPI. The outcome is good. Patient remains the H. pylori free for quite a good deal of years and do not have usual recurrence of the gastritis and peptic ulcer disease. Perforation, obstruction, bleeding, they are not that common nowadays, but they are also possible as complications.